Hi, gandang hapon mga ka-Try! Welcome back to TryPH Media Updates. Ito pong inyong lingkod na si Rome Rob, live from Tagaytay City here in my home studio. It is a Friday afternoon. Alas 2 ng hapon po tayo tuwing Monday, Wednesday, Friday. Happy hapon po sa inyong lahat, lalo-lalo na yung mga nakikinig at nanonood sa atin dito sa Facebook Live via the TryPH Facebook Live page at sa YouTube ng TryPH Media. We are also seen in the JTech Solutions Facebook page. Kaya kung nariyan na kayo mga ka-Try, huwag nyo nang kalimutan po to like this video, share it with your friends, and follow us here on Facebook. Ganun din kung nasa YouTube ka kaibigan, well, alam na this. Kayo po ay magsipindot na ng subscribe button. And of course, hit the notification bell. Yung bell na yan na mahiwaga ay kailangan para naman ma-notify kayo every time we have a new video. Maraming salamat po. Muli ang ating palabas hindi natin makapili ngayon si Tandem Dave dahil he's on a very important assignments. Hindi lang po isang assignment but maraming assignment po yung ating kaibigan. However, hindi po siya nawawala, katry po natin yan. And of course, he bids his greetings to you all. Samantala po, habang nagluluwagan ng mga bagay-bagay dito sa ating bansa, we would like to give you today's TryPH updates. Para po sa mga nangungunang updates natin sa araw na to, March 18, 2022, yung pasahe sa train ay hindi naman tataas. Good news. Wala namang gasolina yung train. Utos na balik opisina ng BPO or Business Process Outsourcing ay bawiin daw muna. Balik opisina na ba o wag muna? And Dagupan City ay kumukulo sa isang bagong record for the highest heat index this year. Siyempre, summer na ka-Try. Kumusta na ba dyan sa inyo? Summer na rin ba? Oy, alam mo hindi biro yung summer ngayon, mapakainit. Kaya alamin natin mamaya ang detalye dyan. Pansamantala, tiniyak kahapon ng Department of Transportation or DOTR na hindi magkakaroon ng pagtaas ng pasahe sa LRT1, LRT2, MRT3 at PNR. Ayon kay DOTR Undersecretary for Railways Timothy John Batan, maigpit ng bilin ni Transportation Secretary Arthur Tugade na hindi magtataas sa pamasahe sa tren. Maigting na palaala, instruction ni Secretary Tugade na walang inasahan at walang pinaplano na pagtataas pasahe sa linya ng ating mga tren ani Batan. Idinagdag ni Batan na batid nila ang pagtaas ng presyo ng langis na makakaapekto sa presyo ng bilihin kaya hindi ito sasabayan ng kanilang sektor. Oy, buti naman. Yes. Kung pwede lang mag-train na lang, ano? Napakala, taas na ng gasolina. Bira, ang sakit mag-drive. Anyway po, tungkol naman sa mga bumabiyahe at speaking of gasolina na papunta ka na sa opisina. Dahil sa pagtuloy ng pagtaas ng presyo ng fuel, hinimok ni Sorsogon Governor Chis Escudero at tumatakbong senador ang pamahalaan na bawiin ang nauna nitong kautusan na magbalik opisina na ang mga empleyado ng Business Process Outsourcing o BPO centers sa Abril 1. Noong una, COVID-19 ang kalaban natin at nandyan pa rin naman ang banta ng virus, pero ngayon tila mas malaking banta ang linggo-linggong pagtaas ng presyo ng petrolyo at ang nagbabadyang pagtaas din ng presyo ng mga bilihin ani Escudero. Nagutos ang Fiscal Incentive Review Board na pinamumunuan ni Finance Secretary Carlos Dominguez III sa mga BPO company na nasa economic zones na mag-opisina na ang mga ito sa unang araw ng susunod na buwan dahil kung hindi ay maaring mawala ang kanilang tax incentives na isang hakbang na mariing tinututulan ng mga manggagawa sa BPO at maging ng Philippine Economic Zone Authority. Oy. Kayo ba ka-try? Work from home pa rin o balik opisina na? Yan, magandang ma-comment nyo yan mamaya para tayo ay makapagbasa ng inyong comment. Samantala, kumusta na ang init sa inyong lugar? Well, ang heat index sa Dagupan City, Pangasinan ay umabot sa pinaka-peak na 53 degrees Celsius kahapon. The highest so far nitong taon na to, as it broke the 51 degrees Celsius record noong nakaraang Sabado. Ang heat index o yung temperatura na nararamdaman ng katawan ng tao ay base sa air temperature and relative humidity na pinagsama. The Philippine Atmospheric Geophysical and Astronomical Services Administration o PAGASA ay nagsabi ng Dagupan City ay nagkaroon ng air temperature ng 35 degrees Celsius at relative humidity na 74% sa parehong oras ng alas 5 ng hapon kahapon. PAGASA classifies ang index that is more than or equal to 50 degrees Celsius as extreme danger. Sa ibang lugar naman, ang record high index nung kahapon ay ang CLSU Muñoz sa Nueva Ecija na may 42 degrees Celsius at ang Daet in Camarines Norte na may 43 degrees Celsius. Kainit! Napakainit, katry. Sana ay hindi kayo magsawa ng yung lalo na yung mga nagnanais na bumiyahe o kinakailangang makarating sa kanilang mga trabaho, negosyo. Tiyagain po natin ng konti, magdala ng inumin. Keep yourselves hydrated para hindi rin tayo magkakasakit o magkaroon ng tinatawag na heat stroke. Delikado rin po yan, katry. Huwag natin pababayaan. Importante ang mabuhay, ang mag-survive dahil sa mahigpit na ekonomiya, pero ano naman ang magagawa natin kapag nagkasakit tayo? Kaya naman, speaking of sakit, ayan, itong Friday edition natin ng ating TriPH Updates is also dedicated to the medical technologies o medical advancement or know-how na kinakailangan malaman ng ating mga kababayang Pinoy. Lalo-lalo na itong buwan na to, do you know, it is the Colorectal Awareness Month. Oy, ano ba yun? Ano itong colon cancer na to? Kung naririnig nyo na yan, paano ba maiintindihan anong mga nagiging causes niyan, paano maiwasan, ano yung mga current treatment? Well, TriPH Media has contacted siyempre yung ating partner na PSMO or Philippine Society of Medical Oncology para naman po may paliwanag sa atin ang topic na to. Ang ating invited guest ngayong hapon ay isang medical oncologist practicing in Davao City. Oy, mga Davaoenyo, kumusta ka mo diha? Residency and training in internal medicine at Davao Doctors Hospital po siya. His fellowship training in medical oncology at St. Luke's Medical Center. Currently a member of the governing council of the PSMO or Philippine Society of Medical Oncology, and currently the committee head on outreach of the PSMO. Please join me, ladies and gentlemen, welcoming Dr. Abdiel Galicia. Oy, Doc Galicia, kumusta po? Live na po tayo sa TriPH Media.
Good afternoon, Rob. First of all, I would like to say thank you. Salamat sa TriPH for allowing us, PSMO, to use your platform to spread awareness. Aware population leads to an educated population, leading to a healthy population, and a healthy population progressive and successful. And therefore, from the Governing Council of PSMO, Jerome, thank you very much for all of this.
Oh, you're welcome po, Doc. Very welcome po kayo rito. And everyone in the PSMO, syempre, kinukumusta natin si Doc Kat Hernandez to make this interview possible. Thank you, Doc. Just ano lang po, konting kumustahan. Saan po yung location nyo ngayon, if you don't mind? And kumusta ba dyan ngayon ang panahon?
Yes, I'm in Davao City and the weather is hot. Summer na. And we're like we're just like Manila, the issue about COVID, level 1 tayo, getting better, improving, opening up.
Nice. No? Although talagang mainit, Doc, no? Itong mainit na usapin din natin ngayon, Doc. Marami rin sa mga katry namin ang nagtatanong itong colon cancer. Na
Yes.
marami hindi talaga nakakaintindi niyan, Doc. Maybe if you could help us understand ano po ba talaga itong tinatawag na cancer of the colon or colon cancer, Doc Galicia?
Uh, Colon cancer is a medical concern. That's why it is a big topic that we need to discuss. And um, Jerome, can we? Yes, that one. Let me explain clearly by showing you the picture. Most of you, bata pa tayo, alam na natin that this is the colon. If you look at the lower part in the right, there's a small, parang, we call that the appendix, right? Familiar tayo halos. And just there, it starts, that's the colon. There's what we call ascending colon, and then transverse. And then it goes down, descending. And then we call that sigmoid, and then rectum, and then it exits into the anal area. So that's, when we talk about colorectal cancer, we're actually talking about the large intestine. Diba? We are aware that there's a large and a small intestine. When we talk about colon cancer, specifically, we're talking about mas common siya sa colon, large intestine. So we divide it, colon and rectum. It's actually the large intestine. The division is mainly because of the characteristic. To some extent, they are the same colon, but to some extent, may difference characteristic and response to treatment. So we divide it colon and at the same time rectal cancer.
Yun. At
Then let me continue, Jerome. Can we have the
Go
second?
yes.
When we
Ito
look
po
at inside, yes, yan yon. Inside, yan yung nasa taas, yun yung lumen ng rectum. Yan yung tae, diba? And then the most superficial is the epithelial layer. Diyan lumalabas yung cancer. And we call that colon cancer. And usually, it started with a polyp. Yung polyp, hindi yung cancer. And not all polyp are cancerous. But there are polyps that eventually, when they enlarge, doon nagde-develop yung abnormal cells or cancer cell. And then when it goes down and it affects already whole part of the body of the colon, we call that colon cancer. And cancer, as a word, uncontrolled growth, lumalaki, nag-i-spread, nagpo-cause ng problem, and pag tinanggal mo, there is a possibility of coming back. And then even it's just in the colon, pwedeng lumipat sa lymph node, liver, lung, brain, and other part of the body causing problem. So it's really a medical concern. When we're talking about concern, it's let me give you the numbers, okay? It's third among incidents. The most common will be lung, breast. Minsan po nagpapalit yung breast, number 1. Minsan lung. Pero pangatlo doon yung colon cancer. In fact, may mga data, 2018, 1.8 million around the world developed colon cancer.
Wow.
But iba yung incidence, iba din yung death, Jerome. Yung namamatay dahil sa sakit, higher. Some data said 4, some books say 7. Kaya there is a need for public information. Why? Because if we can get it early, it's curable. So if a better population lead to a better nakukuha natin yung sakit earlier, then a lot will be curable and therefore a healthy population.
Yun. So, kailangan lang mahuli agad ng maaga. Paano ba nagkakaroon, Doc, ng colon cancer ang isang tao? Ano ba yung mga risk factors na involved dito, Doc Galicia?
Right. Okay. Number 1, a personal or family history of colon cancer. In other words, parang it runs in the family. So, yun yung major, parang there's something, we call that genetic defect or sa mga medical terms, gene mutation, na it's embedded in your gene na most likely lalabas to sa family nyo kasi sa gene nyo may sakit. There are specific, may mga considered talaga na syndrome like hereditary non-polyposis colorectal cancer, Lynch syndrome, familial adenomatosis polyposis, mga medical term na yun, Jerome, ano? Pero sabihin na natin na, di ba yung word na nasa family nyo, parang tumatakbo sa pamilya nyo. So, malaki ang possibility na if you are grandparents and then parents, they have colorectal cancer, high risk ako. Parang ganun, ano? Okay, then we have other factors na it's always, even in other cancer like alcohol intake, smoking, they are associated with colorectal cancer. Jerome, obesity is also one of them. Kaya these are modifiable. Ito yung mga risk factor that we can do something. And then diet, okay? Studies showed that low fiber diet increases the risk. And also red and processed meat. Now, I'm not saying that red and processed meat are bad at all, but they increases the risk.
Yun. At kanina may nakikita po tayong parang Doc, yung symptoms ganyan. Ano ba yung karaniwang symptom para masabi ng isa ay malamang, dapat medyo nakabahan ako, baka may colon cancer ako, Doc.
Yes. So, most likely, mapipick up natin, for example, darating sila sa doktor. The data now, that is what happening now, na pag dumating sila sa doktor, tapos when we check on them, nasa late stage na.
Wow.
Stage 3, stage 4. Pumapasok na tayo sa tinatawag nating non-curable, di ba? We can treat, they can survive, they can live longer, pero non-curable. And according to the book, the majority of asymptomatic. Kaya, bakit nga ba, Doc, dumadating sila na medyo, higher stage? Kasi, majority na stage 1 to stage 2, walang symptoms. Ganon. Ito yung population ngayon, Jerome, na we can do something na kahit asymptomatic pa sila, we can do something. Yeah, we call that screening. But let's talk about screening later on. Symptoms, okay. A bowel change. Yung, di ba? Parang nagbago yung yung pattern ng
yung rutina.
Oo. Doc, paano? Una yung nagda-diarrhea, tapos after that hindi makatae. Okay, di ba? Hindi naman lahat ng diarrhea. Most common cause of diarrhea, infection yon. Pero pag nag-infectious diarrhea ka, pag nagamot ka na, gumaling ka, okay na. Pero parang yung in a period of time, parang pabalik-balik, tapos minsan di makatae, ganon. So, parang masasabi mong nagbago yung pattern. And another alarming is pag may dugo yung kain natin. Okay, not all. Huwag matakot. Hindi lahat ng may tae sa dugo, cancer. Pero alarming signs na ang ibig sabihin nun, check up, kailangan nun. Okay, and another one, Jerome, itong nagbago yung pattern ng pagtae, nagbago mismo yung consistency ng tae natin. Parang minsan, the most common description is lumiit, tapos maliit at narrow. Ganon. Nakakita ka na ng tae ng goat, Jerome?
Yes, oo. Mga bugal-bugal.
Oo, ganun. Bata pa ako, medical student pa lang ako, yun ang description namin palagi sa symptoms. Goat-like. Ang tawag natin, goat-like salivary stool. Yung parang, ganun, diba, lumiit, tapos parang jawline.
Yes.
Parang something na nagpaliit ng lumen ng colon natin. Kaya pag dumadaan yung tae, lumiliit sila, pupul-pupul. Oo. So, baka there's something wrong inside. So, yun yung mga symptoms na check up ang kailangan nun. Okay.
I see.
Pero, what is important is yung gusto natin, sana ma-pick up natin yung wala pang symptoms. Yan yung pumapasok yung screening.
Yun.
Okay?
Oo. Paano yung screening na yan, Doc? Pakipaliwanag. Yan ang importante.
Yes, let me emphasize. Kung i-screen natin lahat ng tao, ano yon? Sobrang gastos, masyado yung lahat magiging bothersome sa lahat. Pero sabi ng mga studies and journals na yung i-screen natin, sila yung high-risk population. Okay? So, yung na-mention natin before, for example, nasa pamilya ninyo, mukhang may mga pinsang ka, parents, or na nagkakaano, at 45 years old, it's good that you undergo screening. Ang recommendation naman sa iba, kunwari, how about, Doc, hindi ka pa 45 years old. Ang suggestion doon, you try to check yung mga nagka-colon cancer sa pamilya nyo. Okay? Kung younger sila, then you try to average the age. Then, at that age, dun dapat nagpapa-screening ka na. Okay? So, how do we go about with the screening, right? There are acceptable screening methods. Okay? Ang screening means procedure na ginagawa sa wala pang symptoms. Okay? Ang purpose nun to pick up the early stage. Okay, you see that colonoscopy. That's a gold standard. Kita nyo yung tube na maitim, pinapasok yun sa puwet, tapos may video yan. Nakikita ng doktor. So, makikita niya talaga kung may growth. Na-remember mo yung kanina yung polyp? Oo. Tapos later on, magiging ulcer na siya. Kung hindi ulcer, bumabara na talaga siya. May bukol na it looks like a pliable mass, sometimes bloody, pero hindi na normal yung architecture ng colon natin. So, yun. Makikita yun sa colonoscopy. But, colonoscopy is expensive, tapos data showed na parang may hesitancy na nakakatakot naman, di ba? Ganon. So, a cheaper form of screening method is what we call to test the stool. May mga ganon. For example, common sa atin yung guaya, fecal occult blood. Pero there's a newer version right now in checking for the stool, that's fecal immunochemical test. So i-check lang yung pupo mo. So, sabi nga nila, mas hindi ito nakakatakot. Most likely yung tao, okay lang sa kanila na gagawin to kasi hindi masyado, di ba, yung procedure and the expense. Okay. Pero pag nag-positive ka doon, you will proceed with colonoscopy, then after that, kung may nakita, biopsy na. And then, diagnosis na yon. Treatment will follow.
Yun ang pinaka no, para hindi ganun ka intrusive yung may mga options na pala, Doc, na mga tulad kong medyo takot sa ganyan.
Agree. Nakakatakot nga, no? So, remember, uulitin ko, hindi lahat ng may ganong symptoms siguradong colon cancer na. So, wag matakot. So, all you need to do is, the minimum that you can do is just have a consult. Di ba magpa-consult ka lang? Mura lang din yon. Tapos magtatanong ka. Tapos pag na-assess ka ng doktor, most likely sasabihin niya na mukhang hindi naman po, di ba, yung concern nyo, mukhang hindi naman, mukhang okay. Or alarming nga yung concern ninyo. Mapipick up yun yung doktor na you need to do something. You need to proceed with screening and then further work. Tapos,
Yun. Doc, marami ang nakakapanood sa atin ngayon at may comment sila sa ating YouTube channel. Isingit ko lang itong question na to, Doc. Mula kay Jersey D, Sa anong edad po usually makikita ang early signs of colorectal cancer? May certain age range po ba? Yan ang thank you, Miss Jersey.
Jersey,
Mm-mm.
very good question. Oo. We have recommendation based on international study, ganon. And yung pinabasa ko kahapon, 50 years old, di ba? Ganon. Tapos may nababasa ko ngayon sa ibang database na just 45 years old. Oo.
Oy.
Oo. Pero pero pag yung ibang recommendation, when you are in a family na possible familial hereditary, check ano yung average age ng mga relatives nyo na nagka-cancer sila. Then by that age, I think warranted for you to have screening.
Yun.
Pero in general, 50. Okay?
50.
45, okay na din.
At marami namang ibang paraan na kung takot doon sa colonoscopy, meron namang iba na non-intrusive at
Yes.
just the same mahuhuli. May pahabol na question siya, Doc, may pahabol. Oo. Bakit cute ang mga oncologists? Requirement po ba yon? si Doc Kat, siya nagpasimula kasi niyan eh. Cute daw mga oncologists. Oo. Thank you, Miss Jersey, sa iyong question. Doc, tungkol naman dyan, na-screen na nalaman o you're confirmed meron kang colon cancer. Ano po yung gamot? Meron po bang ano yung pinakamagandang approach doon sa treatment po kapag you've discovered, may colon cancer ako, Doc Galicia?
Yes. Confirm na. Ang ibig sabihin nun, na gawa ng colonoscopy, tapos na biopsy. Tapos, pagbalik ng biopsy, sasabihin niya doon, adenocarcinoma of the colon. Confirm na yon. Before we proceed with treatment, we stratify treatment. It is based on staging. So, before treating, we should know the stage. And so, doon lalabas yung complete workup. Okay. Doon na lalabas yung tinatawag nating multidisciplinary approach in treatment. Papasok yung mga ibang doktor, di ba, no? Na makakatulong. We help in the staging, in workup. We also the one who gave chemotherapy. And then, kung kailangan ng surgery, we have the surgeon. Kung kailangan ng radiation, we have the radiation oncologist. Part of the workup, gastroenterologist, ganon, colorectal cancer, andyan din sila. And then the other part of the multidisciplinary treatment approach to colorectal cancer.
Yun, kumbaga parang multidisciplinary team ang kailangan para sa approach.
Okay. And then, lalabas na yung staging mo. Clinical pa yun. Then we follow guideline kasi doktor tayo. Yung what is acceptable. Hindi lang dito sa Pilipinas but internationally. And those guidelines are backed up, proven by extensive studies. Okay? Yeah. So, doon na yun. We would like to pick it up, diba? Early stage sana, 1 and 2 lang, gano'n.
Right.
Pero kung 3 and 4, may magagawa pa rin tayo. Then doon papasok tayo. Usually, kung hindi siya stage 4, surgery ang pinaka-main treatment nun. Tatanggalin mo talaga. Tatanggalin mo. Okay. And then may dagdag yun. Pwedeng before surgery, chemotherapy plus radiation or minus radiation, and then followed by surgery, and then yung iba, surgery, after surgery, chemotherapy plus or minus radiation.
Yun, ang pinaka pwedeng treatment para sa may colon cancer. Meron po bang mga bawal tulad ng mga pagkain kapag nalaman mong yan, may colon cancer ka? Yes, confirm. Even lalo na kung early detection, Doc, meron bang pinagbabawal na food or any kind of activity para sa may colon cancer, Doc Galicia?
Generally, we recommend, there's what we call, a healthy diet, and it's in general it's high fiber, more of vegetable, limit meat, right? Especially red meat and processed food. I did not
Mhm.
say stop, but the word there is limitahan, right?
Mm. Mm.
Uh, to some extent, wag siyang gawing hobby. Okay? Then,
Mhm.
in all respect of medical treatment, kahit na pagkain ng rich fiber is always, di ba, advisable, even with the issue of diabetes and ibang sakit na hindi cancer.
Tama,
And
tama,
then,
oo.
smoking
Mm.
and alcohol intake. Oo. Pero wala masyado, Jerome, na specific na itong food na to, nakakakos talaga ng colon cancer, wala namang,
Mhm. Mhm.
kapag ito bawal na talaga, parang wala naman.
Yun. O, kasi yung iba may mga pamahiin dok no, na ipag kumain ka ng ganito, ayan, magkaka-colon cancer ka. Wala
Oo.
naman specific pala. So any lifestyle din talaga dok pala no, kung tutuusin no.
Oo.
Lifestyle din.
Oo, nakalimutan ko, good exercise is always.
Right. No.
Obesity is associated as a risk factor. So, exercise
dapat ay
and healthy
exercise.
life.
Kapag meron dok na nito at yan confirmed na may colon cancer ka na, may pag-asa ba talaga na gumaling from this? Magtatagal pa ba yung buhay ng isang pasyente o meron bang life expectancy na talaga yung mga may colon cancer, Doc Galicia?
Tatlo yung nakuha ko sa question mo. You mentioned the word gagaling ba talaga? Cure. Sa English po yun. Magtatagal, survival. Yun yun. And then, ano nga yung pangatlo?
May life expectancy ba talaga ito? May limit?
Parang ganun. Ang goal natin, as much as possible, we would like to cure. We can cure early stage. Kaya nga gusto natin ma-pick up sila sa early stage because ang goal doon, cure. Yung talaga, possible na gagaling. Oo. There's a possibility. Then, pag na-treat ka, yung goal mo, cure. And then, although may possibility na babalik siya, hindi na curable later on yon, parang stage 4 na. Pero maraming patient na dahil sa treatment modality ngayon, makikure. Okay. Let me talk about treatment through time. Nung medyo matanda na rin ako, Jerome, tapos nung nag-start ko ng training, more than 10 years ago na yon. Alam mo, from that time on up to now, ang daming nagbago. Kaya kailangan nag-aaral ka ulit, hindi pwedeng doktor, hindi siya nakikinig or hindi nag-aaral ulit, sumasali ng conference, nagbabasa, kasi nagbabago ba mga data pumapasok, tapos most especially mga bagong gamot na dumarating. Oo. Now, pero tama yung sabi mo, merong certain stage na hindi natin maku-cure. Anong i-offer natin? Survival ang tawag doon. They can live longer. And when they live longer, to some extent, we would like them to live better life. Meron nga yung iba, may cancer ako, pero wala. Buhay ako, tapos parang normal yung lifestyle. Yung iba, dahil may colostomy sila, nakaka-affect, limitation of lifestyle, pero they are alive and they are happy. Ganon. Yung iba naman na in pain, may mga gamot tayo doon. Aside from chemotherapy, we have palliative medicine. Okay. Now, let me minsan yung pag pumapasok kami ng discussion tapos nilalabas nila yung mga gamot, tapos yung mga bagong gamot. Sabi nga nila, nung lumabas itong gamot na to, na-extend yung buhay ng mga stage 4 cancer ng 1 year. Tapos, pagdating ng gamot na ito, in-extend niya pa ng 2 years, gano'n, 3 years, 4 years. Tapos ang claim nila ngayon, more than 5 years, gano'n. So, we have come, dumating na tayo sa point na, mas better tayo ngayon compared to before. The availability of medicine, newer medicine and better medicine.
Yan ang ating talaga good news dyan, Doc.
Oo. Doon, yung medyo hirap tayo doon sa pricing and cost, Jerome. Pero we are happy, DOH, yung government natin, Department of Health, is pushing, doing something
Right.
to help. We understand, our situation economically, pero may mga tinawag Nicolo,
Yun yung mga bago na gamot yan, Doc. Bagong
no,
gamot yan.
law na
Law.
mga laws, na to para ma-access man lang, matulungan
Itong
regarding
may
medication. Nagpapatayo ng mga centers, hospital centers around the country para maano lahat.
And of course, supporting yung mga education ng mga tao na maintindihan yung mga cure at saka treatment dito. Doc, may preventive measures ba na pwedeng gawin ng isa to totally avoid o at least minimize the chances na magkaroon siya, lalo na kung may family history, Doc Galicia?
Oo. Ang sagot ko dyan, dun sa mga high risk, hindi natin ma-prevent, but we can do the screening. So that we can get it early. Kasi genetic mutation nga, pag meron ka nun, mangyayari yon. So we would like to get it early so that we can treat before it spread. And then, yung diet, ganon, hindi guarantee yun na pag hindi ako kakain ng red meat, sigurado ba hindi na ako hindi
colon cancer.
Ganun. Tama, yung word na ginamit mo, prevention yun eh. Prevention, screening, ganun yun. We can do much on the screening. On the prevention, wala pa tayong gamot na, inumin mo to para siguradong hindi ka
magkakaroon. Well, ayun, Doc, no? Marami pa talaga kaming gustong maintindihan dito. I'm sure na we don't want to take up all your time. Baka may mga final messages ka, Doc, para sa ating mga viewers, some advice that you can give para dun sa mga meron na yan or may family history, they want to find out how they can prepare, what treatment is available and all that. Doc Galicia, please.
The minimum we can do, hindi naman mahal yon, hindi rin nakakatakot. I advise for a consultation. Go to your nearest doctor, internist, a medical oncologist, gastroenterologist, surgical colorectal surgeon, for your concerns. Magtanong-tanong lang, consultations, and then that's it. Matutulungan ka, and most likely baka sobrang worry, then wala naman pala. Pero at least mapipick up natin kung along the way may problem talaga, then we can get it early. So it just starts with a simple consultation.
Ayun, maraming salamat kay Doc Abdiel Galicia para sa discussion today on colorectal cancer awareness month. Thank you, Doc Galicia. At I'm sure na yung mga katry natin nanood na may mga tanong pa, pwede naman kayo mag-post at saka doon sa social media site ng PSMO, you can actually avail of their services. Mako-contact din po doon si Doc Galicia. Maraming salamat sa lahat ng ating mga tagapakinig. May mga from different countries, sina Nenet Sato from Japan, nandyan din sina Grace Gainilo, Kat Castro Pereira, Juvian Galicia. You can comment din po kung gusto niyo. Mamaya lamang babasahin natin po lahat yan. Huwag kayong aalis. Babalik po ang TriPH Media matapos lamang ilang mga paalaala mula sa ating mga sponsors.
LMP Auto Car Care. For all your car care needs, visit LMP Auto Car Care, located at National Road, Lingayen, Pangasinan, the home of funeral homes. We honor the lives of the ones you love. Call us at 438-3421. Life Extension Philippines. The science of a healthier life. Stay healthy, live better. For orders, please contact Life Extension Distributor Luzon. Plants by Isabel. We care for plants. We care for people. Visit our garden at CP Garcia Avenue, UP Diliman, Quezon City. Have you been looking and waiting for opportunities to be globally competitive? How long have you been searching for a way to enhance and align your academic documents without leaving your job or spend long hours studying? Wait and search no more. Ralph Consulting, the academic consultant for the Philippines of the London Institute of Business and Technology, LIBT, can help you align your academic documents and be globally competitive. With LIBT's diploma and degree programs, you will be able to get the competencies and certifications you have been waiting for only a short time. Plus, you may apply for a scholarship grant that will give you a 50% discount on your tuition fee. What are you waiting for? For quick processing and approval of scholarship applications, visit rlbalmaceda.com/education or email at ralph@libt.co.uk. At Ralph Consulting, we support to keep you going.
At nagbabalik po ang Tri-PH Updates para sa inyo lahat. Isang magandang hapon doon sa mga humahabol na mga comments at mga pagbati. Maraming po salamat. Nais nating pasalamatan yung mga nag-like, nag-heart sa ating live show today sa Facebook and YouTube. Andyan si Miss Abby Makapugay, Agapito Bandola, si Ma'am Teresa Hernandez, si Sir Jet Mangaliag, Bossing Big Cortez, Doc Cathy Hernandez, thank you very much. At syempre si Miss Melanie Marquez, naging guest natin dito yan, a patient ni Doc Cat. Doon sa mga nagbigay ng comments, basahin lang natin si Doc Cat Hernandez. Good afternoon Sir Rome and Dr. Abdiel Galicia. Ganon din si Jersey D. Happy Friday afternoon Sir Rome. Weekend na naman, nag-aapoy ang mga updates nyo. Parang kalsada lang dito sa amin. Oo nga, mainit dyan sa may Muntinlupa City. Nandito rin si Sir Daryl Bet Patricio. Good afternoon classmate, you're looking great. Same to you. Ayan ang kumbaga modelo namin ito si Daryl Ito yung sexy nung high school Oo, baka pwedeng pa-shoutout naman sa Patricio Group of Dental Clinics. Thanks much. Shoutout sa mga nasa Patricio Group of Dental Clinics. Oy, in-invite namin sila yung nasa Patricio Group of Dental Clinics para mag-guest dito. Mapag-usapan naman natin ang may kinalaman sa ngipin, lalo na sa pandemic. Ano ba yung mga importante? Baka hindi na kayo nagsisipag toothbrush. Si Feel at Home with Maggie, ito yung YouTube channel ng ating Tri-PH Ambassador to the Netherlands, si Maggie Baz. Good morning po Sir Rob, at sa lahat ng mga nanonood, have a nice weekend and tulips. Maraming salamat Miss Maggie. Si Ma'am Rowena Canta from Italy, thank you for discussing another important medical topic. Happy weekend to Emma, Minami, and friends. Happy weekend po sa inyong lahat. Ganon din kay Bossing Victor Cortez Jr. Thank you Doc sa informative material. Actually, nasa biyahe ngayon yan si si Bossing Vic. Next week nandiyan yan siya sa May Isabela. May tanong sana si Miss Melanie Marquez, yung Almoranas po ba nagpapataas ng risk? Mamaya baka mag-comment si Doc Galicia sa iyo dyan sa Facebook. And si Miss Grace Gainilo, good PM po Doc. And Sir Ron, maraming salamat po sa makabuluhang topic at sa mahusay na pag-discuss ninyo about colorectal cancer. Thank you po sa libreng advice. Keep safe po. And of course kay Miss Teresa Hernandez, hi Doc Abdiel, well explained. Yan po, maraming salamat sa lahat po ng nagbigay ng comments, nag-like, nag-share ng ating video sa hapon na ito. Abangan nyo po kami Monday, Wednesday, Friday for topics about responsible travelers, tourism in the Philippines, technological innovations of the Pinoy. Kasama na po dyan ang mga medical information and advances natin dito sa Pilipinas. Marami na po yan sa Pilipinas. Marami na po tayong medical advances sa treatment. Tulad ngayon, napag-alaman nyo, hindi lang colonoscopy ang pupwede para lang mag-screen tayo ng colon cancer. So meron pong ibang paraan, avail na po natin yan habang maaga pa. Sabi nga ni Doc Galicia kanina, it is better to catch it early. Para doon sa mga nag-aabang din ng mga ilang balita, tomorrow wag kayong mawawala 7 to 8 a.m. sa Stand Up with Oro. Maririnig po sa mga nangungunang radio stations sa Southern Luzon at ganun din mapapanood kami dito po sa Facebook and YouTube at sa Broadcast Channel 6 local TV station dyan sa lalawigan ng Quezon. Para po sa iba na hindi po namin nabati ay pasensya na po at medyo papagalitan na ako nung ni El Presidente dahil nag-overtime na naman tayo. Okay lang naman po yan. Magpapasaging na lang ako, magpapakape kay El Presidente. Thank you so much. And in behalf po ng aking katandem na si Tandem Dave Oro, ako po muli si Rome Rob, live from Tagaytay City for Tri-PH Updates. Iwanan namin kayo ng aming hamon, lalo na para sa iyong weekend na ito na saksakan ng init. How far is far? And how high is high? Well, you'll never know unless you try.